Thank you for joining us for this interactive Facebook Live event presented by Siteman Cancer Center based at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis. Siteman is an international leader in cancer treatment, research, prevention, and education. Ranked among the top cancer centers by U.S. News and World Report, Siteman also is one of only a few U.S. cancer centers to receive the highest rating of exceptional from the National Cancer Institute. Welcome to today's Facebook Live.
Welcome, and thank you for joining us today on our discussion about cancer patient care and support services. Today we have with us two Siteman Cancer Center experts who are our integral part in our cancer patient care. We have Nurse Administrator Shannon Cruz, as well as Registered Dietitian Nartana Mehta. Thank you both for joining us today. As part of this live discussion, we welcome our viewers to submit questions in our comments section. Our experts will be able to answer those later on. Alrighty, so Shannon, I'll start off with you. When we talk about support services for patients, what does that look like, and what type of services are available at Siteman Cancer Center?
So support services are a piece of the therapy that's not really a piece of the treatment. So the treatment includes chemo, radiation, surgery, and these are services that will help patients and their families as they're going through that treatment. And some of the services that we offer at Siteman include nutrition counseling. We have counselors to talk about psychosocial issues. We have pet therapy where we have dogs come into our centers and try to relieve stress as patients are going through therapy. We offer yoga classes at all of our locations. We offer massage therapy so you can come as a patient or a caregiver while you're getting your treatment, take a break during your treatment day and relax in the hands of a professional massage therapist. We have art therapy. And we have recently joined teams with the Botanical Gardens, and they're coming in with plants and different things into the garden to come in and do therapy in our treatment rooms. And then you can take that home and do it as gardening at home. We also do offer some mindfulness classes at some of our locations, and we have social workers who are available to help provide other resources at your home or in your life that you may need as you go through this process.
Okay. So I know you've been a nurse now for 15 years, and how have you seen support services evolve in that time? What have been some of the biggest changes that you've seen?
So it's been incredible. I think we've realized that patients really need support services more than we knew before. You know, we were always worried about taking care of their cancer from the medical perspective, but there's really so much more to the person and the family that they need to go through this journey. When I started 15 years ago in oncology nursing, we had one dietitian for the entire Siteman Cancer Center, one social worker, and we had some counseling available. So we've really expanded the services. We've also grown in our locations. We now have 6 different Siteman locations, and we offer these services at all of the locations so that it's more convenient for patients. They don't have to go to a certain location to get these support services, which was a limiting factor for a lot of patients. So it's really been incredible how much we've grown in the quantity and the types of support that we do provide.
Perfect. That's amazing. So I would like to remind our viewers, once again, if you would like to submit a question, do so. Our experts will be available to answer those questions later on in this segment. So, Nartana, there have been a lot of changes as well in nutritional care for patients as well. For you, what have been some of the biggest changes that you've noticed?
I think the biggest change is that the recognition that nutrition plays a major role in cancer treatment, and that the dietitian is an integral part of the healthcare team. I think that is definitely the biggest change recently, and in the last decade or so. Like Shannon said, when she started, there was one dietitian. Now there's multiple dietitians at each location. So just really the fact that nutrition is such a big part of a person's journey through their treatment.
Okay, and with that being said, can you tell us how you and other Siteman dietitians kind of work with the patient as part of their extended care team?
Yeah, so eating for the cancer patient, eating guidelines for the cancer patient are a lot different than your typical suggestions for healthful eating. So for the most part, the nutritional recommendations are designed to address the side effects of treatment and the cancer. So, we offer, we do a lot of screening and assessing for nutrition risk based on diagnosis, comorbidities, treatment plan. We will offer strategies to help minimize side effects and optimize nutrition status. Optimal nutrition can really help prevent malnutrition, or it can also correct malnutrition. It can help minimize treatment interruptions, and I think most importantly, it helps with quality of life.
Okay. Okay. And Shannon, for you, let's talk about some other support services that are available at Siteman Cancer Center. I know you mentioned some in the beginning. We have pet therapy, there's music therapy, art therapy. How are these programs and these services, how are they beneficial to patients that are receiving treatment?
Sure. So I think that they're beneficial to the patients and the caregivers that are taking care of the patients in different ways. So each one has different benefits, but we've learned that most of the ones that we offer reduce stress. So that's one of the biggest things that people are going through when they're going through some sort of a cancer diagnosis. They have stress about their disease, about the finances that they're going to face, about the side effects, and if they're able to work because of what they're going through. So reducing that stress is really important. We can also, through massage therapy, we can reduce their pain sometimes, and we can improve their ability to sleep. Some people have a lot of restlessness with just their thoughts going through this. Music therapy, and some of the art therapy, yoga, we can improve mood and, really just try to take off some of the emotional burden, but also, as I said, some of the physical burden through massage therapy and some of the different touch therapies and yoga that we offer. We can reduce some of the physical side effects that they're experiencing.
As you know, some of our viewers are caregivers, and as a caregiver yourself, as well as a manager of caregivers, what advice do you give to your nurses or even some of the caregivers that come into the Cancer Center about how they can best, take care of themselves and how they can, be recharged in order to better be prepared to take care of the patient that's in their life, whether it's a patient as a nurse or your loved one has cancer? What is some advice that you give them in order to help them recharge?
Sure. So I think it's really important for caregivers to know that it's okay to take a break. There's a lot of guilt as a caregiver that they feel that they have to be there 24/7, and it's really important that they don't do that, and that they step away during the day, whether it's during the treatment day or at home, and they give themselves a break, because sometimes too much time they aren't able to continue to make themselves positive and happy, and together that won't be a good thing for them and the patient. And sometimes the patients, they take their frustration and their sadness or their anger out on the people they love the most, because they know those people are not going to leave. So while they may know they're not taking it personally, it can be a lot to take on. And so we tell them, while the patient is, resting or they're getting treatment and they have other people caring for them, go out and take a walk or go shopping or meet a friend for lunch, and give yourself a moment to take care of you, because when you come back, you'll be a better caregiver when you do that. And same for our nurses. We tell them to take breaks frequently throughout the day. And it's really important that they find ways to get rid of their stress. So if they utilize our services, if they want to go get a massage during therapy, if they want to take a break and go out in the lobby and spend time with the therapy dogs, we have lots of art projects that they can do while they're there. And they can do those things at home too. And it's really important that they take some of those therapies home with them. You mentioned nurses, and we have a resiliency program where we really try to promote ways for them to promote wellness on a daily basis. So taking 5 minutes, if they've had a really stressful moment with the patient and they need a break, we ask them to walk away and their coworkers can cover for them. We also suggest, exercise. If they can get out at lunch, get some fresh air, or, and when they're finished with a long day, go for a run, take a walk, do a yoga class. And then we really promote team building so that we build each other up as nurses and, caregivers as well. And if somebody's having a bad day, it's really important that there's a strong person that's gone through this team building, that they can support their colleague and give them the opportunity to get away, or explain that, while you feel like this has been the worst day, you've done so many amazing things to help these patients. And it's important for us to remind the caregivers, the loved ones of patients, that they're doing a great job too. It's really hard to watch your loved one go through this treatment, but it's important to recognize that those caregivers are doing a phenomenal job, just as much as you are getting chemotherapy as the patient. Giving that support emotionally and physically is equally hard.
Great. Absolutely, and that has to be key, especially recognizing it for what it is and not being too hard on yourself and realizing that as a caregiver, you also need to recharge, refocus, and then, like you said, you'll be an even better caregiver to the loved one in your life or your patient. So we have a few questions from our viewers, and I'll ask those. So Jen asked, what are some items that you would suggest having on hand at home as a caregiver to a cancer patient? So I guess that can go to either one of you, whether it's from a nutritional standpoint or it's from a patient care standpoint. What are some items that that you know would be beneficial to someone who has a loved one at home to have on hand?
Do you want to?
Yeah.
So with regard to nutrition, when a patient is having issues with appetite, it can be really hard for the caregiver to try to find something that the patient wants to eat or can tolerate. And so my advice is always to have just a variety of things and to be patient with themselves and the patient and just keep trying, that it's not the same as it was pre-diagnosis or pre-treatment. That they just have to keep trying different things, and something will work. So just to have a variety of options.
Okay.
And from a patient care standpoint, I mean, sometimes there's medical issues that patients need support and resources. So if there's somebody having trouble with oxygen or with getting in and out of a bed, it's important to talk to your physician team and get connected with the resources to get maybe a medical bed or a walker in the home to make it easier to get around. And then, if you need home oxygen, they can set you up with home health. And if there's any other things from the medical perspective, talking with the team and the social worker is really important to involve them. And then I think you have to remember, you got to keep it lighthearted at home too. So things like having music, having a radio or a way to play your favorite music, and that'll help people's mood. And if it's nice out, to encourage, both of you to go outside and get some fresh air, or invite, if they're comfortable with the patient's comfortable with it, invite a friend over and let them spend part of the day with them just for a change of scenery and a change of perspective. And then the caregiver can also take a break during that time.
So this kind of leads into our next question from Margaret. I think you touched on it a little bit. Margaret asked, where can I get advice about caring for someone with limited mobility?
Sure. So there's a couple different ways. With limited mobility, you can talk with a social worker, as I said, about like a wheelchair or a cane or a walker. But if it's a mobility issue, even getting to and from your treatments, sometimes we need to involve other resources to get transportation for the patient. Sometimes the caregiver can't do that all by themselves. And so there's American Cancer Society offers a Road to Recovery program where they offer transportation to and from patients' treatments, because sometimes the caregivers also have to work and they can't be there for every treatment. So if you talk with a social worker, they can help connect you to those resources. We also, in a stressful situation when you can't get something set up because you need to have it set up the next day, the social worker can sometimes support you with a taxi or a ride to treatment. So it's really important to ask and not forget that there's a team of people supporting you to help you with those things, because we have lots of resources available.
It's very good to know. I have one last question right now. It's from Rachel, and she asks, what kind of activities can a caregiver to lift morale during hard times? And I guess that can be for either of you.
So I think there's a lot of different things you can do to improve morale, and I think it depends on each patient. So if they're able to get out of the house, I think it's a great thing to try to do that, even if it means you're taking a wheelchair and going to the botanical gardens or getting outside somewhere, even to the park and having a picnic. If you're limited with mobility, have a movie party at home, rent some movies, get some takeout pizza, take the stress off of somebody even making the meal. Music therapy, doing the gardening if the patient's able to do it, or even just the caregiver to go out and plant some flowers, be out in the garden, be outside. And if they're able to do exercise, even if that's a walk together around the neighborhood, or you enjoy going to the gym and you're able to still do that. We have a lot of patients that are still able to be active and they still go to their regular boot camps or their exercise classes. And it's great not only for their physical ability, but they're seeing the people they regularly see and they're keeping up with their normal life. And I think that really makes people feel like maybe the cancer isn't defining them.
Right, those are a lot of great ideas. Now, Tana, as a dietitian, you are a crucial link or important link between the clinical care a patient receives as well as the care a patient receives once they go home, from helping them in that standpoint, as well as their loved ones. What nutrition or menu advice do you give to patients as well as their loved ones in order to help them to help them out in order to make sure they're staying on track?
So I think more than anything in the oncology setting, weight loss is an indicator of poor prognosis with the cancer patient. So I think more than anything, I'm always telling people to maintain their weight and not restrict food in the sense that, they avoid something because they think that it's not healthy. And that, they have to eat, like I said before, a variety of things, lots and lots of calories, and, that it's just super, super important to maintain weight.
Oh.
I think that would probably be the thing that I talk about the most.
Okay. And to that point, I understand that there have been studies done on different types of food or the way the foods are prepared in order to make those foods more appealing for cancer patients, especially those who might be undergoing chemotherapy. Can you tell us a little bit about that?
Sure. So, when somebody has a poor appetite, presenting food in a way that is more appealing can be really helpful. So, for example, putting a huge plate of food in front of somebody because you want them to just eat and you're so concerned about them not eating enough, it can be really overwhelming. So go a little smaller. Start with a really small plate with just a little bit of food. You can always go back for more. Adding color with, fruits and vegetables. If they like, if their favorite food is pancakes, having pancakes for dinner, eating their favorite food any time of the day. Just really, making sure that, as Shannon said earlier, having something enjoyable while they're eating, like music or a movie or friends or anything that brings some normalcy back to their life can help with the eating issues as well.
That's very good advice, because I know it has to be a challenge for people, when your appetite changes and, the things you like, whether, like you said, whether it's pancakes at dinner, just as long as they're getting the nutrition that they need in order to continue to move on. So do you have any other advice on helping patients get the nutrition and energy that they need?
So I don't have, just a blanket statement. Optimizing nutrition is so, or nutritional status is so individualized. But I think more than anything, talk to a dietitian, talk to somebody who knows. There's so much misinformation out there that could actually really be harmful.
Okay.
So, even if somebody gives you advice, although, it's coming from a good place, to always run it by somebody in your healthcare team.
That's great advice. We all know, with the internet nowadays, there's a lot of information out there, but it might not necessarily be true or what's best for you. So this question is for the both of you. We mentioned some of the support services that we have available: pet therapy, music therapy. Is there anything else our viewers should know about caring for a loved one with cancer? And I can start off with you, Shannon,
Sure.
and then we can go to Nartana.
I think just knowing that it's okay to feel that you're overwhelmed, and that's normal to feel overwhelmed, and that it's emotionally and physically taxing not only on the patient but also equally on the caregiver, and that you should take time to take a break and take care of yourself. And I think to know that also you don't have to go even to one of our locations to get these supportive services. As we said, these therapies that we've introduced here at our locations are just the beginning of how you can do that at home. So take time to do the stretching and the yoga at home if you enjoy yoga, or take time to put on music. Sometimes we even forget that we have that radio at home, and it's amazing that you just turning on their favorite music for the caregiver, even themselves, putting that on while you're doing some of those, chores or things that you have to do to help. It can really change the mood of how you're doing it. And then, don't forget that other people want to help you, and it's so easy to say no, even as a caregiver. If somebody offers to take your loved one to treatment, or if they offer to bring you a meal and you say, you don't need it, this is the time to say yes. So really accept the help from other people, because there's a bigger support community than you take advantage of a lot of times, and it could really take the burden off you even for a few minutes of a day. And so I would just saying this is the time to say yes.
That's very good advice.
Yeah, I think she covered most of it,
Okay.
but yeah,
Yep.
I would have to definitely agree with asking for help or accepting the help is really huge for both the patient and the caregiver.
Perfect. We got another question that came in from our viewers. Debbie asks, are there any specific foods a cancer patient should avoid and any food they should consume? So
No, I don't think that there's one food, that I can say for every single, diagnosis to avoid or to, there's not one food that's going to cure cancer. Again, I think, it's really individualized, so I can't really answer that in terms of one food. But I always say, if there is no trouble with appetite, eating a balanced diet is always the best.
Well, thank you. Well, we've run out of time. I would like to thank you both for joining us today about this important topic. And to our viewers, thank you so much for joining us. I would like to encourage you to please follow us on Facebook, our Siteman Facebook page, to learn more about the upcoming Facebook Live events we have, as well as a range of cancer topics.